So, Surgeon General Vivek Murthy has talked about the epidemic of loneliness, especially in this, post-COVID world that we're living in. How do you address this, and especially with those who are the elderly and living alone?
Yes. So, I had the pleasure of talking to Dr. Murthy over the years on loneliness. He had written a book about it. So we were on a TV segment a few years ago. He was just flying back from the UK. He was in between his two terms at the point when we had first met, and they had just appointed a minister of loneliness in the UK. And we were talking about how amazing that is, that it's something that's recognized. And over the last several years, I've been doing a lot of study on it, and it's a huge part of the practice when I'm working with patients or whether it's talking about it publicly. We know that loneliness increases our risk for mortality. It doubles our increases by double risk of depression. It decreases our immune system, increases risk for cancer, for stroke, for heart disease. And loneliness isn't just about the number of people that we have in our lives. It's about the quality of the connection. We can be in a room full of people and still feel lonely because we don't feel heard, we don't feel seen, we don't feel validated. And so a big part of what I suggest to people is asking yourself, when's the last time you went deep with somebody? So there are, of course, so much value in what I call social snacking or micro connections, which is, you're walking your dog, or you're seeing a barista or a bus driver or whomever you're crossing paths with. You're at work, maybe you're working from home, but you only go into the office twice a week. You're at the elevator. Make the time, build the time to have the social connections. Be intentional about when you are going to see people. Ask them how they're doing. Follow up on things. If they had shared with you somebody had passed in my family, ask them, how are you doing? How are you feeling? Be vulnerable. I think so much of what we're missing are the meaningful connections where we go deep in what we call this idea of emotional attunement and emotional responsiveness, where we are actually listening. Active listeners, on average, people who have active listeners in their life, they live 4 years longer. There's less risk of dementia in their lives because they have people who are invested in their outcomes. And so the idea of social support across the board, whether it's post-traumatic stress disorder, anxiety, depression, recovering from surgery, from having a biopsy, and the recovery in skin healing and immune system, there's just so much value in social connection. So I would say, prioritize that. And I always give people what I call the 4 M's of mental health, and it's something that I had to come up with in being able to communicate in 59 seconds how to improve your mental health. It was April 2020, and I got a call that Global Citizen is having this international program, and everybody will be on it. Elton